So today I'm going to be doing a wet to dry dressing. First, I'm going to start off by identifying myself to the patient. So my name is Tidra Larkin, and today I'm going to be dressing your wound. Before doing so, I have to make sure I get proper identification, so I'm going to go ahead and ask the patient for his name and date of birth. So can I please have your name and date of birth?
John Brown, May 25th, 1989.
So I check to make sure that everything matches and everything does. So prior to doing this, I checked 30 minutes to make sure that his pain level was under control. Everything was good, so I didn't need to administer any pain medication. So now I'm going to go ahead and put some gloves on. Before doing so, I'm going to do hand hygiene. Okay. I'm going to put some gloves on. I'm going to go ahead and remove the old dressing. I got to make sure to be careful because I'm dealing with somebody's skin and it could cause irritation, so that's off. I'm going to go ahead and take the old dressing out, the bandages, the sponges. So this one I'm going to go ahead and count it so I have an idea of how much to put in when I'm redressing. This is 2, 3, and 4. Now I'm going to wrap these up. Take my gloves off. And then I'm going to throw it out. I'm going to do my hand hygiene again. Always got to be clean. Put my gloves on. At this point, I'm going to go ahead and check the wound to make sure everything is good. It tends to be healing right. It doesn't have, like this black part is not on the inside. There's no drainage, there's no odor, so everything is good. So now I'm going to go ahead and remove the gloves because now I'm ready to dress the wound. But before doing so, I got to set up my sterile field. So I'm going to go ahead and pull this back. First thing I'm going to do is go ahead and take out my trash can. Then I'm going to put it to the side. Then I'm going to pick this up, open it. I'm trying my best not to touch anything on the inside because that's all sterile. Then, even though this is up a little, I can leave it because now I'm going to go ahead and dump what's in my tray out. I'm not going to hold it too high or not too low. I'm going to hold it just right, pour it out. Now I'm going to put this to the side because inside is sterile and I'm going to need that for my sponges. Right now I can't touch anything right here. So now I'm going to go ahead and put my sterile water inside of here. Before doing so, I'm going to go ahead and put my sponges in first so it could be moist. I'm going to go ahead and peel. I'm not trying to touch those sponges, so it's this. That's one. Okay. That should be 4. And then I'm going to go ahead and pour my sterile water. I just want enough to make it a little bit damp. Now I got that done. I'm going to let that sit there for a second. I'm going to go over here and put my sterile gloves on. Take it out of the packet. Put this to the side. Gonna open it. I'm gonna start around here. Gonna make sure to bend it so it doesn't fold over. I'm gonna get this side. Now I'm gonna go under right here and then go. Now I'm gonna use my dominant hand to pick this up and then put it in. Okay. If you realize I'm just touching this part, now I'm gonna go ahead and make an L. Put this. Okay, it's all good. Gonna go on, put it on. Okay, so I got my fingers all, so now this is sterile, so I could just go ahead and fix my fingers. Okay, so that's on. And I would go ahead, go under, and pull my gloves over. So now I'm all good. So now I'm gonna straighten out my different equipment, because before I couldn't do that because this is sterile. Now I have my sterile gloves on. So everything is straightened. Okay. Now I'm gonna go ahead. I'm gonna pick one of these out. I'm actually gonna use one of these to make sure to clean the wound, just to make sure that everything is good. I'm gonna throw this out. Now I'm gonna go ahead and open these. Make sure it's moist enough, but not too wet that it's dripping all over the place. Open it up. Then I'm gonna use this. Okay. I got a little drip, but I'll wipe that up after. Gotta make sure everything is in properly. Okay, that's one. Squeeze that out a little. Now go ahead. Making sure everything is good. Okay. Now I can get like other areas. Okay, I'm getting this out. Giving me a little trouble, but let's go. Okay. Okay. Now I'm gonna use the last one to like fill out the wound area. So it's all good. So, and okay. And now I'm gonna go ahead and put my covering on. For doing so, I'm gonna go ahead and just wipe, dab, dab. You see my dab? Throw this out. Then I'm gonna go ahead and put this over. Now I need my tape. Go ahead and tape around. Okay. Make sure. Okay, got it. Make sure it sticks. Okay. It's not on the backpack, so. Now I got that on. Right now I'm gonna go ahead and make a split right here because I don't want it to be like in the butt crack. Okay. And then I could go ahead and just tape right there. Now it's pretty good. Now it's all good. I'm gonna go ahead, now I can go ahead and take my gloves off. By doing so, I'm gonna go ahead and go under. Take it off. Look up. And then I'm all done.